welcome to the CDO magazine interview series. I am Kiran Kanetkar, currently working as VP of Data and Analytics at Pendulum Therapeutics. Today, I have the pleasure of talking with Jacob Hesterman, Chief Data Officer at Therapeutics. Welcome, Jacob.
Thanks.
Great. So let's dive into it. So can you just give brief background about your company? Can you tell us about radiotherapeutics and what interests you about this up and coming field?
Absolutely. Yeah, no, very happy to. So Therapeutics is a radiotherapy company. We've been around for about a year, a little over a year. And we're developing compounds for targeted radiotherapy. So what that means essentially is having molecules that are designed to specifically target tumors or targets that are expressed on tumors and are attached to radioactivity, especially beta and alpha emitters that are designed to, that as they decay, emit energy which can kill tumor cells and therefore be efficacious in treating a variety of different cancers. And so it's an exciting field as a complement to maybe some of the more traditional radiotherapy techniques like external beam radiotherapy.
That is great. So does this help in reducing side effects or anything about the treatments?
Yeah, so it's a great question. So it has both potential benefits in efficacy, but also in safety and toxicity, because if you can imagine now you're administering intravenously one of these compounds, and so if it has the correct clearance properties and accumulation in the tumor, then you can get very specific targeting of that tumor while sparing a lot of the other tissues, such as like kidneys or other organs that you might be worried about from a toxicity or safety standpoint. And so it shows great promise in delivering, sort of increasing that signal to noise ratio in terms of the delivery to the tumor while minimizing the side effects for the other organs.
That is great. Thanks for that context about radiotherapeutics. So how do you apply data science in this context, in drug development industry?
Excited. There are a number of ways that this can come into play. And in my role, again, because we're a smaller company, so often you might wear a few hats, I get to touch a lot of different areas. And so purely from the data standpoint, I think you can imagine, especially in the early discovery and development phase where we are right now, there's a huge number of studies that we need to run across a variety of disciplines, and often with external vendors while we build out our own laboratory or have our own facilities, but that will also continue. There's just so many different studies you need to run with a variety of different groups that you're collecting data, often in the form of very nice reports that might be organized in a nice folder structure or something like that, but not necessarily structured as we would want to do so from a data science perspective. And so one of the both challenges, but also a very rewarding aspect, is to figure out how to take these really disparate types of data and reports and ingest them in a structured way so that we can make direct comparisons both across experiments, in experiments across different areas, but also within an area across multiple experiments.
I can totally relate to that. Even in my company, we have a similar kind of a setup. We have a lab scientist who are really looking at the lab data and see how to get some insights from that data. And then there is again the commercial side, right? Dealing with the customers and then getting analytics from that. So it's definitely crosses multiple disciplines. So that gets us to the next question I had for you about really, this is multidisciplinary, right? So how does this multidisciplinary nature of radiotherapeutics impact the data and analytics?
It is, and you touched on a little bit with lab scientists, but also now thinking about, all right, we have a massive biology component, but also chemistry, medicinal chemistry and radiochemistry, and then pharmacology. And as we look to translate, now you're talking about imaging and other disciplines. So even within our small company right now, we have mathematicians and physicists and chemists and biologists and folks who are a little more focused on the scientific discovery and folks who are a little more focused on the operational delivery. And so one of the challenges is, all right, how do we set up a data model so that we can store the data across all of these different disciplines, but also make it accessible and useful and usable by people who are, come from all of these different backgrounds and often are looking to do a variety of things with this data. And so that's one of the, I don't want to present a challenge without maybe talking a little bit about how we then think about it and attack it. And one of the ways that we do so is to try to spend a lot of time communicating with those different groups and understanding, what are the key pieces of data that sort of span the groups that we might want to really focus on indexing and cleaning and making sure it's really robust and structured, versus what are maybe some of the nuances and details that we want people to be able to have ready access to and look up for that deep dive if they need to, but might not need to undergo the same sort of rigorous cleaning and indexing procedures as some of the more fundamental data points.
That's great. Thank you. So I understand that there is, as you mentioned, there are challenges in laying out the data for this. So did you have to come up with any specific techniques to have your data framework really support this multidisciplinary data?
So yeah, there are a couple areas there, and some come down to technical solutions, and some come down to communication and teamwork type solutions. So maybe on the former first, it's again having those dialogues and discussions on understanding, all right, what are the pieces of data that you really need to extract from these reports or these data sets? What's the understanding the heterogeneity of how that data will be acquired and what might be visible there, and then working internally with our collaborators and externally with our collaborators to ensure, hey, let's work on some standardization or in formatting or even naming, whether it's variables or just that structured data within. And then a little more on the technical side, we've adopted strategies where we might be using slightly different technical tools to support, let's say, more type data, versus often we're working with image files or large chemical structures. And so how do we have the appropriate software and data management tools to handle those types of data sets, which might be very large or complex, and integrate them into maybe a more a traditional relational database that we might use for some of our data mining and reporting.
Yeah, absolutely. I think I can totally relate to some of the comments that you made about standardization of the data and especially the metrics, especially when you are talking of multidisciplinary kind of metrics. Sometimes people, one department might think something in one way, the other might think in different way. They have a totally different definitions. That's where having common definitions of the metrics definitely helps to make sure.
Yeah, definitions in the dictionary, and making sure that when we sit down, if we're all using the same nomenclature, that everybody's interpreting it the same way, which can also be, because each of those little disciplines has their own jargon that with which they're comfortable. Absolutely.
Definitely. Yeah. And then, so this is really a drug discovery kind of a industry. So how does the data requirements change when you go from early drug discovery to the late phase of the development?
For example, where we are right now, it's a lot of scientific decision making and being able to fairly rapidly and in a scientifically flexible way, because also we're talking about, we've introduced biology into the equation, so that already is going to kind of increase variability and variance. And now we also have the pathology of cancer, which even takes normal biology and turns it on its head often. So there's a lot of energy that we need to go put in right now into, all right, how do we, again, I think it comes back to capturing data points that we can extract efficiently and maybe combine with more nuanced information in an ad hoc way to make scientific decisions. So having that ability to routinely extract those core parameters we were talking about earlier, but combine them, again, sometimes ad hoc with maybe study specific or question specific information so that we can draw the conclusions we need. That's sort of a paramount importance right now. The whole point of doing that work, though, is to make those scientific decisions so that as we build towards, let's say, late phase, like a phase 3 trial, we've made those decisions, and now it becomes a matter of increased operational scale to execute on those decisions that we've made in a very rigorous, robust, well-documented way. And so we need to ensure that our platform, our models, are capable of storing and managing the data in both of those two paradigms.
Yeah, absolutely. I think one part is definitely making strategic decisions based on data, but the execution is really where rubber meets the road. That's when you need to make sure you can use that data and execute well on that. So that's great. Thank you, Jacob, for joining me today. You explained in detail how your industry is handling some of these data challenges. So that was great to talk with you about this. Please visit cdomagazine.tech for additional information about interview. Thank you.
Thanks so much. I really enjoyed it.